the different options that you have when it comes to having an overuse injury, or repetitive use, or I actually like to be specific about how I describe it, and it's a repetitively using your body part poorly. So in this case, we're focused on the hands to the shoulders, right? That's what you're here for, and that's my specialty. So yeah, let's get started and just let everyone jump on when they can. So this definitely applies to actually the majority of the, and I'll say overuse, but hopefully you know what I mean by that. Again, it is just repeatedly using our hands, wrist, forearms, arm, shoulder in a poor way. Okay, and I know that itself sounds vague, but basically we keep using our bodies not in the most safe way, not in the most ergonomic way, not in the best posture, not in the best alignment. And so doing that over and over again can lead to these chronic injuries, right? So, you know, you're looking at the DeQuervains, you're looking at the carpal tunnel, the tennis elbow, the shoulder impingement, the rotator cuff injury, the cubital tunnel, the trigger finger, the TFCC injury. Okay, so the different options that you have, one of them is to just wait and see if it goes away on its own, right? So that's always an option. That's something that I don't recommend, and it might be a biased recommendation, but no, truly, I don't recommend it. I always tell individuals that I work with, you have the better chance of recovery from it the minute you start feeling it. Hi, thanks for joining. So the sooner that you go get checked out, the better. Okay, even if it's something minor, I would very much recommend get it checked out, right? If it turns out to be nothing, great. If it's something that we can do something about, then we want to get started now so it doesn't have a chance to become more severe. Okay, and yes, you know, when sorry, my hand's shaking. I like talking with my hands, and that makes my other hand shake. I get asked often if these injuries can resolve on its own. And you know what? It's possible, but we don't know which category you will end up in, right? I don't know if your injury will spontaneously resolve or if it turns into one where there needs to be intervention, okay? And even if yours spontaneously resolves, it can come back. Okay, if you're continuing to use your hand up to your shoulder, you continue to use it poorly, it is very possible it's going to come back, and it's going to come back even more pissed off. Okay, so that's your first option. You can hope that it resolves on its own. The second thing you can do is to start with conservative treatment. So that would be like seeing me, an occupational therapist, okay, or a therapist that specializes in treatment of the hands to the shoulders. So first of all, let me go ahead and say a little side note on that. If you do have an injury from your hands to your shoulder, which I'm assuming you do because that's why you're here, you want to see a specialist, okay? Not just an ordinary physical therapist or an occupational therapist. You want to see someone who is also a certified hand therapist, okay? That means that we have, meaning I do too, I have that extra certification, that extra specialty. That means we've done extra work. We have extra experience, a good extra 2 to 4 years of experience in this specialty before we sit for an exam to be specialists in this, okay, to be certified in this. And we continue to work in this specialty, and we continue with continued education. So blah, blah, blah. we're specialists in this, okay? So you want to make sure that that's who you look for. And if you're having trouble finding someone who is a specialist, reach out to me, or you can go to htcc.org and they'll be able to, you'll be able to find a CHT in your area. Okay, so yes, going back, you can do conservative treatment, and conservative, when I say conservative treatment with a therapist, that means that it's not invasive, okay? That's not the route where you go in and have to have a cortisone shot or surgery, okay? We try and look and see if we can help fix the body or fix the environment or help in any which way before we look at all those other options. And, again, it's not biased. It's going to sound biased, but I believe that everyone should have therapy, okay? Whether or not you decide to continue with it, whether or not you decide to take the next steps, like I mentioned, cortisone shot or surgery, because whatever you decide, like I said, it can flare up again, okay? Or if you have a cortisone shot or surgery, you need to make sure that you have therapy afterwards to make sure that you continue on the right path of healing. Okay, because cortisone shots and surgery, those are, that is each one is a full separate live on its own. Those are big topics itself, but in my clinical experience, yes, having a shot can be the end. Oftentimes it's not. Surgery can be the end. There are patients that it's not. Okay. Yes, go ahead and type in your question. And I'll try and answer it at the end. But yes, so I always say do therapy first. Okay. So, not only do you get knowledge about your injury, but you will get a home program to make sure that you prevent a flare-up, okay? And like I said, if you have a cortisone shot, hi, thanks for joining. If you have a cortisone shots have the best success if you do it in conjunction at the same time as with therapy, okay? Because cortisone shots, those are, like I said, it's not always the end all, okay? More often than not. But if a person does therapy with it, better chance, okay? But like I said, the most important, one of the many things that therapy can provide if you decide on choosing that, again, highly recommend, is that we're going to teach you how to modify your everyday tasks so that it doesn't flare up again. Okay, because you can do all the exercises in the world, you can wear all the braces in the world, but if you go back to doing what you were doing, that added to pissing off your hand, wrist, arm, shoulder, whatever, it's going to get pissed off again. Okay, so we teach you all that stuff that is, I hate to say it, but it's those lifelong modifications that we have to do to protect our body. Okay, and so if you don't do therapy, you're not going to learn all those important things. So honestly, therapists will give you that home program to make sure that you don't flare up again, because you kind of have to look at those injuries as it's chronic. It's in your body's now history, and it can flare up again. But if you have your home program, that's like your bag of tricks that helps you to know what to do so that it doesn't get to this high level of pain again. Okay, so that's the other second option. The third option is, like I was talking about, a cortisone shot. So a cortisone shot, I don't know why I just said so, but a cortisone shot is an option that your doctor can provide for you. And that's something that, you want to take seriously. I know doctors, they are wonderful, they mean well, but sometimes they can be injection happy and they go straight to it. And unfortunately, they often think that's the end all. Okay, they think that's it, that's all you need. And oftentimes they don't even know themselves that that is more often than not just a Band-Aid. Okay. And it makes sense, right? If it's just this thing that helps to decrease the inflammation, but you go back to doing what you have been doing, it's just going to re-flare up that body part. Okay. So this is why I say do therapy in conjunction with the cortisone shot. Okay. So get that pain down in the immediate, and then you can work with your therapist to then get you moving forward. Okay. If anything, I like when they get the cortisone shot, because then that means we can really work. Okay. Sinister laugh. I'm kidding. No. But it means that we can really work, because if your pain is still high, then sometimes we have to wait until the pain's better before we can get to things that I want to work on. But yeah, so, but I don't mean you have to get the cortisone shot. If you want to just stick to conservative treatment, working with a therapist first, then that's fine too. So that's an option. The last option is surgery. Oh, let me go back to a cortisone shot. Cortisone shots need to be taken seriously too. Okay. Because those are not harmless. First of all, take in mind that usually if it doesn't work after the second, and you know it doesn't work, well, if after 2 weeks your pain hasn't improved, okay, usually about the 2-week mark, that's the most improvement you're going to get. Okay, so if after the 2-week mark there's nothing, then that's not going to help you. The doctor will then say, why don't we try it again? If again it doesn't work at that 2-week mark, then it won't help you. What I'm going to recommend is to not try it again. Okay. After that, you've just beaten a dead horse. It's not going to work. Okay. The other things you have to think about with the cortisone shot is that if you do it too much, first of all, if a doctor says to do it past 3 of them, run. Okay. That doctor does not know what he's doing, but too many cortisone shots can cause a tendon rupture. Okay. That's bad. I have yet to see that happen, luckily. I've worked with doctors who have been very aware to not go past 2 or 3 injections, okay? So, and then it can cause tissue breakdown. Like a lot of people see wear down of that area where that injection happened, kind of like a well happening, okay? Finally, surgery. So a surgery should be the final resort, okay? Again, like a cortisone shot, a surgery needs to be taken seriously, because a surgery, and again, a lot of surgeons, they sometimes don't convey how serious it can be. Okay. So even if it's a small body part, it's still a surgery. Okay. So, and a surgery is not guaranteed. Like, keep that in mind, okay? A surgery has helped a lot of people. I've worked with a lot of people who it's been wonderful. But keep in mind, I've worked with people who have had the surgery. That means they went to therapy after, okay? So if you decide on this, make sure that you be your best advocate and tell your surgeon, tell your doctor you want to at least have 1 therapy visit, so that you have a home program, so they teach you what you need to do to recover from that surgery well, okay? Surgery is not straightforward. Surgeons forget that. It's not straightforward. There's things you need to do to heal well. But like I said, surgery itself is something to take seriously. Okay. You're being cut into. Hi, thanks for joining. You're being cut into. Okay. And so there's trauma. And with trauma, there's scar tissue. And scar tissue, it's your body's natural Band-Aid, but it's also something that can cause problems. Okay. So keep that in mind. It can cause problems itself. And then, like I said, with surgery, it doesn't guarantee. Okay. Again, if you go back to doing what you have been doing, it is possible it can re-flare up again. That surgery doesn't completely remove the problem. It helps relieve some of the pressure that's going on in the area, but it does not completely take away the problem. So if you're doing the same things again, not taking care of your hand, it can re-flare up, which is again why you need to go to therapy. So if you have yet to pick up on the repetition. Go to therapy. Very important, okay? And if you have a problem, reach out to me, okay? So like I said, I am a specialist in this. Okay, let me see if I can answer these questions before I have to sign off to grab my son. Let's see, you broke your humerus bone at the shoulder 3 years ago. I've done PT in 2 different times and still having pain. I want surgery as I still am not able to place my arm over my head without pain. Okay, so 3 years ago. Okay, so, it's a good question. Okay. In 2 different times, still having pain. Okay, so many questions. So my first question is, it's the simplest. Are you still doing any home exercises? You can definitely get a consult. That does not hurt. Always get a second or third consult from a surgeon, an ortho, see what they have to say. I'm gonna also ask, how long did you do therapy with each one? But yes, let's see. Okay, all the time. Sorry, tell me one more time. All the time. That was an answer to, sorry, mommy brain. What do I recommend? I say yes, like I said, get another consult from an ortho surgeon. I would even recommend being seen, like I said, by a specialist. So either a PT with again, like a CHT, certified hand therapist, or a specialist in ortho, okay, orthopedics. I have so many questions, Anel, or Angel, but message me directly, okay, so I can answer those questions, and help you, okay. Let me see. I think I saw, let's see, the pain can go all the way down to the tip of my middle finger. Okay. Is that numbness or tingling pain? Or is that a sharp stabbing pain? Okay. So while I wait for her to answer, let me again. Okay. So if you've had ongoing problems, I know 3 years is definitely a long time, but I've had patients and clients and individuals that I've seen, okay, so it's adult pain. Well, I've seen where their injury is old. And I always believe that there is some gain that can be made, okay? When it's that old, it's very hard to make a full recovery. But what we're hoping for is to make you functional again, right? So that you can go back to doing what you need to do. You're not going to get full range of motion, but we're trying to get you as much range of motion. We're trying to get you as much strength as possible back, right? I would even recommend, like I think I just said, but recommend going back to therapy as you're getting those consults from the surgeon, but making sure you see a therapist specializing in orthopedics. Okay, so that's like a CHT, a certified hand therapist, or a PT that has an OSCS. It's like something, but it's an ortho specialty. Okay, I'm going to go on to this. It's a dull pain, Angel. So, because I asked for a second because I'm wondering if it might be a nerve, like a nerve compression too, but it's a dull pain. But if it's radiating, there might be some nerve involvement. But yes, message me. Okay. And, BLINGNJ, if I cut this off, message me too. My mom broke humerus bone. Oh, everyone's humerus bone is broken. She had reversed. Oh, okay. Nerve damage 6 months ago. She cannot open her hand and wrist drop. She does not bring her hand to her mouth now, but cannot hold an object. Okay. Okay, message me because I have to sign off in about a minute. So there's things that we can do for her too. Same thing. She might not get full range of motion back, but we're looking at helping her get as much range of motion back and function and strength. Okay, so definitely message me so I can go ahead and talk to you about this. Okay, but thank you everyone for coming. Thank you for those great questions. So excited to be able to talk to you guys and answer questions. And as you can see, it doesn't all have to be about the topic I'm talking about, but message me what topics you want me to talk about. Okay, all right, talk to you guys next week. Have a wonderful Wednesday,